6:15, so order. Roll call.
Clarence Campbell.
Here.
I'll skip it. George Boutte.
Here.
Laura Negro.
Here.
Dr. Keller.
Here.
Dr. Horning.
Here.
Joy Hendrickson. Here. Elizabeth Franick.
Here.
Probably should say Rich Huber. For the minutes. Rich Huber. Laura Cruz. Laura Cruz. Okay.
Okay, next item is approval of the agenda.
I'll move to approve.
I'll second.
Motion to approve by George, seconded by Joy. All in favor signify by saying aye.
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 Opposed? Motion carries. Public comment. We have nobody in the room here, anybody online?
My wife decided not to come. She didn't like your signs.
What signs?
Yeah. I got that email.
Oh, okay.
I told her to stay home.
Seeing no public comments, we'll move on to approval of the minutes of the last meeting. Any changes or corrections?
I would move to approve.
I'll second.
Motion by Dr. Keller, seconded by Joy to approve the minutes of the last meeting. All in favor?
Aye.
Aye.
Opposed? Motion carries. 2025 year-to-date expenditures. Remember,
Hello, can you guys hear me?
Yep.
Okay. All right. So here we have the expenditures through September. Very similar to last year, kind of looking like to be on pace for budget. I still hold my breath because a lot can happen in the last 3 months. And then that's also when we're putting more money towards levy and less towards grants. So we'll kind of got to see how it unfolds, but very comparable to last year. So as long as we kind of stay on track with that, I think we'll kind of stay close to being on budget, like we were for 2024. So yeah, 66%, that's pretty close where we want to be for just a little bit under for expenditures, but we usually catch right back up on that once you get everything closed out for year end and stuff. So, but yeah, does anybody have any questions for me reviewing this year's or last year's in comparison?
Sure, why not? Under children and families for grants, we're 93% of the way there. And I'm wondering, as they usually have a lot of the finances reported after the year end, I'm wondering if this is expected to be on target for the full year.
Yeah, I'm gonna just it's kind of a small screen, so I'm gonna open it on my other screen as well. Just children's family, yes, overall they're looking at that, and that's very normal because first we take out of the grant, the grant funds, and then the rest will come on the levy, and you see the levy is only at 48%. So I still, anticipating that they'd be pretty close to being on schedule. And that's what's kind of hard, right? The first 9 months we're using, and children's and family, most of theirs are year to year. They have some that end, like June 30th. There's some that aren't for a full year grant. So, whereas other departments have a little bit more, they're more scattered. The first parts of the year, first we are using, grant funds, and then it starts coming out of our levy that our cost. So being that higher and our levy lower, that's very normal for this time of year, and you'll start seeing it kind of catch up now. Next meeting that we do, you'll see that there's more in levy, bringing that closer to what we budgeted for it.
What I was wondering is whether we have any grants outstanding that we're still waiting on for this year, or are they all in? The grants?
Anything that we've like expended, like we had an expenditure for so far through September, I applied any grant money that we'd receive, would receive for that in there. So anything that, so there's still more grants. There's a possibility that that could go a little bit over budget, which would be a good thing, meaning we got more revenue than we anticipated. Just don't know until everything comes through over the next 3 months.
So are we still waiting to hear on some grants?
No, not that I'm aware of. Terry, do you know if there's any new grants? Everything that is awarded for this year is, as far as I'm aware of.
They were a little behind because they were uncertain. The feds did not pass down that information very timely, but we've gotten all the grants we were allocated for.
Great, thank you.
Mhm.
Any other questions?
Oh, I have another question on that same subject. Is this the area of the budget where we cover nutritional kind of advice and support, or equivalent to what UW Extension has been doing in the past with nutritional education, because we're losing our SNAP educators, Or is that
No,
a different part of our budget, or we come close to
it's
that?
not part of our budget at all.
Not at all.
No, it was allocated somewhere else and it hasn't been reallocated. We have no funding for that.
So do we do anything on nutrition for families, any counseling of that type?
Not that I'm aware of.
Okay.
Yeah,
I guess I would bring it up because, we're losing that.
right,
On the other side.
Yeah.
Educators are going away.
yeah,
Mhm.
yeah.
Thank you.
This is Lisbeth Franick. I have a question.
Go ahead, Liz.
Yeah, under community service programs, it says grants actual budget is a dash and variant is the same. What does that mean for folks that might be listening to this in the future, or listening now or watching now?
And
Why is there a grant in there? Oh, okay. I apologize. They don't normally have a grant in there, but that is our MAT grant that ended. Terry, when did that end? Beginning of the, like, was it like April?
May 31st.
May 31st. So we don't budget for a grant typically. The MET grant did not, it wasn't for sure awarded. So when I do this budget, 2025 budget, I'm doing it in July of the year prior. So I didn't budget for the MET grant at that time.
Budget had already passed before we were notified. This was a very
Yep.
late grant that we were awarded last year.
Yep. So that's just what happens. The dash means, well, I didn't budget for it, but we did get those. So you'll see an increase in grants of that 23,000, but then also under expenditures, under other direct and personal training, travel in there, and those costs, there's the equal amount of expenses. So next year, you probably will back to be seeing a dash under actual end budget. And that does happen in other departments too, where we get grants after budget time is done, which is a great thing because then we'll, have increased revenue to go with that increased expense that comes with it. So, but yeah, that's why that one looks a little bit different compared to last year.
And just to clarify, the
Thank
MAT
you.
officially went to the jail, but we did the case management piece of it. So that little chunk here, was our money because we were helping manage the grant, and then we had the case manager here. The
Yep.
rest of the grant was in the jail, the sheriff's budget.
Yes.
Looks like that happened in public health too, because grants are almost $41,000 over budget.
Yes.
Liz
So
is really good at getting grants.
Yes. There's two things Liz is good at, getting grants and spending money. Right? So she gets the money to go with this. She can get money too, which is great because she's also really good at spending it. And I mean that very lightheartedly. But yeah, so hers, and a lot of her grants are, they end in May I mean, not May, March, June, like, so they're kind of a little bit scattered, and sometimes she doesn't find out about the grant, and then, you know, in the next month we got money, she's got money coming. So that is one department that you will see that in often. Not normally CCS, but you will in public health.
Thank you for your clarification, and thank you, Liz. Dot. Thank you.
Any other questions on financial update? Otherwise, we'll move on to the impact of the federal shutdown.
So thankfully, we all know that the government is open again. It mostly impacted on the federal level. It's called SNAP for us in Wisconsin. It's food share. And I will let Amy take over that discussion.
Thank you, Terry. Let me just say I am really excited about the fact that the shutdown is officially over before we had the board meeting. So good news on the SNAP front. Everybody should have their November food share benefits, so that should not be an issue anymore. And food share is fully funded now until September 2026. So there should be no further disruptions from that. And that's really our short and sweet update for economic support regarding the shutdown.
There was, so I was on vacation last week and I did attend quite a few meetings, so I couldn't tell you exactly which one it was, but the information, I believe it was the Wisconsin Counties Association, they had warned us because Wisconsin had paid full benefits that the federal government, the USDA, was going to sanction states who paid the full benefits. And that would have resulted in us losing, us as a state, but it trickles down to the counties, losing a significant portion of the administrative costs that currently are funded 100%. That's soon to change under this new budget that's coming, or that's here. But I just heard on Tuesday from a different association that because the government is open now, it sounds like they won't be putting those sanctions through, thankfully. That would have had an impact on every county in Wisconsin. And it would have been very punitive because Wisconsin was following the court order at the time. And in a very brief window, they were able to get those benefits out following the court order. And then there was an appeal, but it didn't go through. So we're good.
I do want to add in just a plug-in for my unit with economic support because we are with part of Northern Income Maintenance Consortium, and it is a 12-county consortium, which means that Ashland County economic support workers who are on the call center do handle calls from residents from all 12 of those counties. And the whole time period during the shutdown, especially once members started to become aware of the fact that they may not have the SNAP benefits, the food share benefits that they were eligible for issued, and the time frame was uncertain as to when those benefits were issued. I really do have to give a lot of kudos to my staff for the way that they de-escalated and helped calm people down and directed them to other resources in their local communities.
And, you know, Ashland and Bayfield County also put together a food drive. So it was Dan working closely with Mark Abels Allison and then incorporating many other entities into it. And they did that nationwide. So the community really came together, but people didn't understand, you know, on a national level in Wisconsin, people don't know that SNAP equals food share. So they might have seen it on the news, but they didn't know it was going to impact them directly. And then our workers are getting calls because the benefits aren't on there. And, you know, it was the economic support workers took the brunt of the anger and they handled it extremely well with grace and helped everybody that they can. So they did a fabulous job.
This is Lisbeth Franick. I have another question.
Go ahead, Liz.
Do we know the economic burden on the community, or do we know the effects that for the food shelf, the brick? I mean, was it overutilized or the same, or do we know any data?
I don't have data from the brick, but I heard anywhere from 40 to 60% more usage during that time frame nationwide.
I volunteer with Ruby's Pantry, so
Mhm.
anticipating the SNAP shares, we did order 100 more shares for
Oh.
November.
Mm.
So in October, we dispersed 216 shares. In November, we dispersed, let's just say 312.
Wonderful. Yeah.
Thank you. And thanks for your volunteership.
Any other comments or questions about the impact of the federal shutdown? Hearing none, we'll move on to proposed 2026 meeting dates.
They're on page 12 of your packet, and excuse me, they're kind of similar to what we had this year. We moved our September meeting back to August so that we can get the budget wrapped up and looking good to pass on to the full board. So we continued that date. The April meeting, there are elections this year, so it will kind of be dependent on who's appointed to our board and if there's enough time if there's new appointees to get notice and be here. But so that one could be subject to change. The November one is right between the holidays of Veterans Day and Thanksgiving, which we typically do. So that's the same. Public hearing is always right around there. And then we usually have our February meeting. So really the only two changes are the April and August meetings. So if that works for everybody, we can plan on it. We can change it as necessary, but it's good for people to be able to plan ahead.
Any comments or concerns about those meeting dates?
Clarence,
Yeah, Dan.
the county board is going to meet on April 21st by statute.
Okay.
So,
Yeah, that always seems to happen, you know.
yeah. Yeah, it's always the third Tuesday in April.
Yeah.
So I wouldn't know if the April date's going to work. That's all.
Okay.
But I mean, you could always, well, we'll try to make it work. We'll try to make it work. But just so you know, there is that conflict with the county board the day before.
Okay.
Okay, thanks, Dan. Open discussion for input and comments to be passed along to the Ashland County Board Planning Committee with regard to the upcoming county comprehensive plan.
I guess since I have requested that, I ought to speak to it. I raised this with the Aging and Disability Research Center board meeting yesterday concerning the shift over the next 10 to 20 years in our demographics. And
Can everybody hear him okay online? We can move.
picking up the mic, okay?
I don't know. We can move it a little closer.
I think you
He
should talk
sounds
a
clear
little
to
bit
me.
louder.
Okay.
Yeah, okay. So I'm concerned about the shift in demographics over the next 20 years. Probably, as we're seeing the trends right now, reduced working age level population and an increased retirement and elderly population, and the impacts on our services and health and human services and what that might be and what our thinking is about it. But we're usually so caught up in thinking about what we have to deal with right now that we don't have much time to think that far ahead. But if we can build something into the county plan is intended to be the guardrails, in quotes, for the county board. In other words, the county board is supposed to, with some exceptions, I suppose, to function and to support processes within the context of as the planning has been set. So the plan is, as I see it, for us in Health and Human Services, an opportunity to lay out what we see coming and what we'd like to see brought about to help us function without running into a shortfall or be caught off guard or be going last minute at a request or something. So I see the plan as an opportunity for the different functions, and given the demographics change, I think it's particularly relevant. And we also be affected by the technological change over the next 10 to 20 years to have a huge impact. And then we will have climatic shift over that longer period of time. So there's a lot to think about. And if we can get something into the plan, I think it'll be useful to us.
So the Bureau of Aging and Disability Resources at the state is working on a plan for 2030 and beyond based on the aging population and how we're going to meet those needs. So any information we get, we'll pass on to you, and your committee can review it and see pieces that you'd like to incorporate.
That makes a lot of sense.
Okay.
And anything you want to build on that from a local perspective.
Okay.
Because we are an older county.
Yes.
And we also most geographically dispersed and harder to service elderly people or anybody who lives an hour away somewhere in a difficult part to reach in the county. And people can provide input to this process anytime, just by going on the county website and going to the email address that's under the planning committee and send in your thoughts. It doesn't have to be at this meeting. Thank you.
Any other input or comments? Then we'll move on to public health update.
All right, so I did include information in the packet with some lovely pictures that we had. So end of October, I was actually invited to a roundtable discussion that was held in Superior. So that was hosted by Governor Evers and DHS Secretary Johnson. The discussion at that time focused on extending the Affordable Care Act premium tax credits to ensure healthcare is affordable and accessible in Wisconsin. There was also discussion regarding SNAP benefits, which that discussion is pretty well taken care of at this point in time related to the government shutdown. And then also accessibility of care for rural communities. So one of the main things as far as the extending the Affordable Care Act premium tax credits, depending on which insurance individuals are purchasing, if they're going through the marketplace for insurance and things like that. One example was highlighted. Individuals age 60 and older on average could be looking at upwards of a 361% increase on their annual health insurance tax premiums. So significant concern about people's ability to afford their health insurance, in addition to the rural location that we have in our area with availability of services and other potential barriers individuals may encounter as far as transportation and things like that. So it was a very, very lively discussion at some time, different periods of it, but I think overall it's went very well, and our area was pretty well represented, and everybody I think was heard by the governor and the secretary, so it was a unique opportunity. So and then our seasonal flu updates. So October is typically our busiest time for flu season as far as administering immunizations. For our mass immunization clinics this year, we focused on the influenza immunization. In the years past, we've been able to include additional immunizations like the Tdap and meningococcal for the school age as appropriate. However, due to decreased funding for the immunization program this year, we only had the seasonal influenza vaccines available. We were able to expand to include the intranasally administered flu mist. So we did offer that at the Lake Superior Elementary School on a trial basis this year, and I think overall it went very well. The kids were actually great as far as administering the vaccine. They were all kind of excited, I think, to hand their tissues off to the nurses that were assisting them. So that was a unique opportunity for them. And we did have a favorable turnout as far as our student participation this year. We were actually up compared to the last couple of years. We had 321 students participate this year. We actually had to borrow vaccine from neighboring counties because these had run out of our supply in-house for that particular vaccination exercise. So all in all, it worked out pretty well. So in addition to the schools, we also completed immunization clinics throughout Ashland County, including Butternut Brookside Apartments, the Glidden Senior Center, Legion Memorial Library in Mellon, Sanborn Methodist Church, and at the Ashland Enrichment Center. We also had several small clinics for private businesses throughout the county. So in total, throughout the month of October, there were 436 immunizations administered in the month of October. So they were pretty busy. We reapplied for the naloxone direct program, and we have been approved for that. Our next allocation will be 42 cases of naloxone, so that comes up to 504 boxes. We continue with 4 public health harm reduction vending machines within Ashland County. Inventory in the machines continues to be provided via various lines of grant funding. So the naloxone that is currently stocked in the machines came from a specific grant to pay for that naloxone. And now, once that supply runs out, we will be switching over to the naloxone direct program to supply the vending machines. So optimistically, we will be able to maintain our supply as far as that goes. I still have a pretty good staff in my office at this point in time, so we're holding our own for that. Ashland County became a naloxone direct provider in 2022, distributing a total of 36 boxes of Narcan that year. So since that time, we have increased our community distribution, various outreach, attending community events. We do private education for individual businesses. We have walk-in availability, and then we have the 4 vending machines available now. So you can see in the graph, our Narcan distribution has increased significantly from 2023 with a total of 99 boxes to 2024 with 735 boxes being distributed. And this year, when I put this together, we were at 647 boxes. We're now closer to 670 boxes being distributed. So looking like we will be on track to match the same as last year. The very optimistic part of this, and there's a lot of data still pending at this point in time, but that blue line that goes through the graph is the total number of fatal overdoses in Ashland County per year. And so you can see that in 2025, that blue line takes a significant dip. So there are still cases pending at this point in time, but we are optimistic that the total number of fatal overdoses has decreased since we have flooded the market with availability of naloxone. And then just some foreshadowing for the next meeting. The new lodging code ATCP 72, which is part of the DATCAP program. So environmental health program, inspections of tourist rooming houses, hotels, motels. They have updated the code and it has been published, so it will officially be in effect on January 25th. They changed the licensing classifications as far as how many individually keyed units pertain to a tourist rooming house versus a hotel motel, that sort of thing. And then they increased the fees substantially for some of those businesses. So we are required to reimburse the state a portion of those fees, and that is increasing annually until they reach 15%, which I believe is in 2028, and then they will be readjusting their fees again. So to match the fee schedule, we will be crunching numbers, and at the next board meeting, we'll be presenting a new proposed fee schedule that we can go forth from there to match at least the state rate.
Any questions for Liz? Seeing none, we'll move on to grants update.
So like we mentioned, we found out late that we got our grant for the second year of recovery housing. And we were able to expand that to do outreach in the jail as well as recovery housing and add in peer support for the jail and other outreach efforts, and contingency management, which is new for us. We've never provided it before, but it's a rewards-based incentive program for people who maintain abstinence. And it's been especially found to be effective with methamphetamine use, which really doesn't have a great treatment protocol. So we're very excited. We can serve quite a few people. I think we anticipated at least, really reaching out to our treatment court participants, our CCS participants who might be struggling with that, and continuing to link in folks from the jail, anybody who's interested in treatment, getting them sent to treatment, having the housing available for them afterwards, the recovery housing, and linking contingency management in with it. So we're excited about that. We also, very late in the game, found out that the wellness to recovery court that we have, it used to be adult drug court, and we've just kind of changed the name and some of the focus in that program. That is now part of Health and Human Services. It hadn't been previously. So we're helping to coordinate that and supervise that. And we were not certain we were going to get the third year of a 5-year grant because of the federal shutdown and cuts and things like that. We found out right before the October 1st start date that we were awarded that. However, they fired the project officer at the SAMHSA office, so we don't have a contact. We're kind of really not sure. I mean, the fact that that person got fired is a bit alarming to us because on the federal level, the directive was we're going to cut some Democratic programs or fire some people in Democratic programs, and that happened in this program. So I can't see, or I can't say that I'm fully anticipating the continuation, but right now we're funded. So we're going to continue with the plan that we had and wait till we get either the previous project director, project officer back, who had already been laid off once. Then he was brought back and then he was fired. So we don't know what the status of that is, but we're good for now. I guess that's all we can say. The person who was a project coordinator did resign from that position, so we're hiring a new person to be project coordinator. But the person who had that before was also the project director for the grant, and he has said that he is willing to continue to do that, and it is fabulous that he's willing to do that because it has very strict requirements of who can be that person and fill that spot. And so you could hire somebody that you feel would be approved by SAMHSA, and the process takes 3 to 4 months to get the approval. So if they're not approved, you've hired somebody that you might have to fire. So he has already been approved and he's good and he's willing to do this. So that will continue, and we're just going to recruit and try to make it the best program it can be and really try to increase the amount of participants in there and serve more people and really continue in the continuum of recovery. So I think that's it for the grant updates.
Then we move on to written materials. Any of the supervisors like to highlight anything in their materials? Or does anyone have any questions about anything in the written material?
Just a reminder, this will be the last year you see the WEAP report because we no longer run the WEAP program. It's been privately contracted out.
Board member updates or agenda items, ideas for agenda items.
Okay, so I'll go back to the subject of education for nutrition for very young children. So this got quite a bit of discussion in our Ag and Extension meeting because we're losing those educators. And we're just looking for ideas for how we might figure out as a county to backstop that. Because that very early nutrition before you're even in Head Start is really an important thing for development. And I don't know what the thoughts are around the table, but I'm just raising the subject.
Well, fortunately, anybody on WIC would be receiving that.
I was gonna say WIC would be the main.
Covered as far as the WIC program,
Okay, that's good to know, thank you.
which our WIC office covers Ashland, Bayfield, and Iron County. It's centrally located in Ashland County because Ashland typically has the greatest number of participants. We do provide some education through the prenatal care coordination program and maternal child health program, but we have very low referral numbers and follow-up case for that, so there's not a ton.
If we had more referrals, would we be able to handle it? Would
Yeah.
we?
Through PNCC and MCH, yes.
I mean, I'm just saying staffing wise, time wise. Yeah, okay. That raised another subject, also came out of that same Ag and Extension meeting where our public relations information ability has been thought not to be very up to par. In other words, it's not thought that Ag and Extension doesn't do a very good job of advertising its services and programs. And I'm wondering if we have the same kind of visibility issue here or not. What do you think about that? How do you feel about our visibility and whether we have good mechanisms of public communication are adequate or whether we can improve?
I think Liz's website is fabulous. She has what, 8,000 viewers or something?
For the Facebook page?
Mm-hmm.
Yeah, we've gained quite a few followers over the last couple of years.
So she uses that as a very effective tool for getting information out on all topics. And it can be seasonal. So when it's tick season, she's got information on tick diseases and what to look for. And
over summer, we do the beach report, and that, I think the most activities typically over summer with the beach report. But then we also do, I have a contact with the National Weather Service, so for winter storm warnings and things like that, we're able to post those warnings in a timely fashion as they become available. Weather preparedness information, that sort of thing. And it's a fairly positive response. Occasionally throw in some humor in there for people that are on Facebook. And
Do we have an email distribution?
No,
Do we do anything in conjunction with the Chamber of Commerce?
I don't believe we ever have.
And we don't do anything with a program like Constant Contact, which enables that kind of communication.
I don't think so. I think, there is a newsletter that,
So one thing that we're working on is part of the community health needs assessments, which we do jointly between Ashland, Bayfield, and Iron County in partnership with Tamarack Health. So one of the things that we're working on, and we actually had the onboarding meeting just earlier this week, is essentially a one-stop shop resources webpage. Because like right now, if you're looking for different resources in the different counties, you have to go to 8 different places to find all of the information between all of the counties. So we're trying to take all of the information that we can find as far as all of the resources, whether it be mental health supports, economic support, home heating assistance, different public health programs, things like that. We're trying to take all of it and put it together, and then it will be presented through one website that all 3 of the counties in Tamarack Health have a hand in as far as managing what information goes out. The really nice part about this then is that this company will actually help to manage and update it, so we don't have to be individually responsible for doing it, because I know nothing about website design or anything like that, so that would just not be a good combination. But these people are marketing analysts, specialists, that this is what they do, and they've showed us a demo of what the site looks like, and it's a fabulous website. We just need to plug all of our information into it. So they also have promotional materials that we would all be able to distribute on our, existing social media to direct people to this website for resources. It also offers like personal screening, like you can take a questionnaire, and then based on the questionnaire, it can refer you to different resources based on how you responded to the different questions and things like that. So it's Credible Minds. So
That's it. The name is Credible.
Credible Mind,
Critical Mind is the name of the website.
Credible.
Credible.
Well, we don't have an official name for the website yet.
Oh,
We're still working on that, but that's who the company is.
The company
All right.
makes sense.
So Tamarack is a good partner in that, because they have marketing expertise.
Mhm.
And so we could really partner with that. We'd probably get much better visibility and through a very efficient mechanism. That would be excellent. Could we ask that beyond, just revisit that on our next agenda to see how the progress is going on that?
Mhm.
That'd be great. Thank you.
Question, doesn't 211 Wisconsin provide all those sources in one spot?
They do, but they are not really, they don't push the information up here. I don't believe a lot of people know about 211. The Aging and Disability Resource Center has a database where they keep all of the information pertinent to all 5 counties in our consortium.
Yeah.
Separate from what 211 provides, but 211 is definitely available. I just don't think people access it as well. And I believe that's a United Way program, and I never see it advertised up by us, so.
Yeah,
Oh.
the Tamarack partnership sounds like a really good possibility.
And we partner all the time. I mean, if there's a flu clinic or something, Tamarack will sometimes just copy whatever the Facebook post is, and they do that for the public health. If we know about something, if it doesn't cost us a ton of money, we tend to just help.
Yeah, it bothers me a little bit then some of our organizations become comfortable that we have something on Facebook, because so many people don't bother to look at Facebook, don't even have a connection to it. I don't think it's adequate.
Well, we do the newspapers, flu clinics specifically.
Mhm.
They put that in print. Both the counties do.
I think it's certainly useful, but I just think it's not adequate to the requirement.
So what services are people saying they're not aware of?
I don't think people know what our services are,
Okay.
basically.
I know for CCS, we have a specific staff member that does all of our outreach, like they go out face to face in person, they go to the different events in the community, get the word out about what we do through our programs. So there's a lot of that. We not only keep Facebook up, like we give stuff to Liz, we keep our website for here up to date, plus we do a lot of face-to-face stuff.
It's a lot of work.
Yeah.
Yeah, and we're limited for what social media platforms we can utilize. Facebook, no offense to anybody, because I fall in there, but Facebook is now considered the old people's
Yeah.
social media. But there are limitations as far as liability concerns for Instagram, TikTok, Snapchat, different things like that. Like for an example, with our Facebook account, people can comment all they want, but all of the comments are hidden. They're not visible. We have auto reply set on it that if you were to send the public health Facebook page a message, you will receive a response back. Essentially saying that this inbox is not routinely monitored. If this is an emergency, call 911, or for further assistance, it offers like the main phone number or the general email inbox. But there's certain liabilities that we have to be very cautious with social media that we can't. I mean, I'd love to do a TikTok. I've seen some of the stuff that First Health Network has put out recently, and I would love for us to be able to do something like that, but there's significant issues that could come from it, so we
And-
have to be cautious.
And we're following legal advice on that. If you allow any public comments, they can become public record, and then you have to archive them and keep them for a period of time, and it would be a nightmare and a huge expense. So
And I do know the Tamarack Health social workers, they're quite aware of a lot of the community resources. And then I think they meet on a regular basis with a lot of the resource entities within the county directly. If we have meetings at the hospital, they come here for meetings. So they're usually quite well in the loop as far as resources. So inpatients and outpatients, people in the ER, people in the cancer center, they're all, if social services is in contact with them, they're oftentimes getting information about area-based resources too.
Yeah, I struggle even with our planning committee processes, because we want to engage the public and get a lot of input. And it's very difficult. So the county has a really great website. We have a page on the website, a lot of information on the website, asking people to send in their comments. We have a newsletter. Extension has information out on Facebook. I mean, it's really zero public input. I mean, trying to get public input is very, very difficult. Now here it's different. You're offering services to the public. You don't need their input. You need them to know that we're available to help them. But it's similar to communication process is really, really problematic because it's so fractionated. You can put something in the paper, but 7% of the county maybe reads the paper.
Well, and just to speak to that, it is a challenge, and we encounter that with the Tri-County area and Tamarack Health for the community health needs assessment. That's done. We complete a new assessment every 3 years. We send out electronic copies. We have links via social media. We send out paper copies. We've distributed at senior meal sites. It's paper copies with self-addressed stamped return envelopes are included and individually handed to people. So the population between the Tri-County area is
50,000,
okay.
not even.
We had just over 1,000 responses with this last cycle, I believe it was. Like 800 to 1,000. That is the most we have ever had, ever.
We have a consultant designing the questionnaire to be distributed for the comprehensive plan process to elicit public input. But this would be professionally designed, professionally distributed, and it's a wait and see. But I'm not really. I don't have high expectations because we're also flooded with these kind of requests for feedback and questionnaires that we just don't respond. But I'll let you know what happens.
okay.
Any other comments or suggestions from board members?
This is Elizabeth Franick.
Okay, Liz.
I just had questions. It's that time of year where it's very cold right now, and I just wondered if anybody knew if there's any warming shelters for the unhoused, or what services will be offered to those individuals.
I haven't heard of any yet.
I'm not 100%, but the warming shelter for Bad River.
They usually have it. I just haven't heard it.
Yeah.
Yeah, I believe it's open.
I was saying, I know they've started.
Is it open to all or just tribal persons?
I think it's to all.
I don't know.
Yeah, I can't speak to that.
There was one comment in that ADRC meeting about the facilities at Bad River. Somebody asked about the new recreation center. And the response was that it's complicated.
Mm-hmm.
That the bureaucracy, the liability issues, the processing issues, the fee processing issues. So it's not available to the general public at this point in time. It might be at some time in the future, but it is not for lack of interest and maybe for doing that, but it is complicated and difficult, I guess. Maybe Joy, you seem to be nodding your head.
No, I just know somebody, he was trying to do some fitness courses there, and I asked him why he doesn't use the Bad River Health Center, because it's like right in his backyard, and he kind of gave me that same response.
Okay. That was what we heard yesterday.
Yeah.
My idea was if there would be volunteers during the day or early evening hours that could just do health checks on people, and they could offer them like those warmers. They're like $1 at Super One, hand warmers. Make sure that they have adequate clothes or anything. I mean, some of them you're never going to be able to help them enough because, you know, they don't want help or they're actively using and people are afraid of them. But I mean, they're still human beings. We need somebody to, you know, if there's any kind of entity that would take that on, you know, I lose sleep leaving, thinking about people that are out there cold and hungry. Thank you.
Anything else? Otherwise, we'll have open our second public comment period for input into the comprehensive plan discussion. Again, I don't see anyone from the public. So our next meeting date is February 18th at 4:15.
Move to adjourn.
I'll second.
We even waited for you. Motion made and seconded to adjourn. All in favor?
Aye.
Bye. Happy, wonderful Christmas and Thanksgiving, everybody.
Same to you.
Opposed? Meeting adjourned.
Yeah.